Hello students, welcome back to this video. I am JJ from Jwala's Educare. So today I am going to discuss with you guys 5 NCLEX practice questions which are from Cardiology unit. So let's get started into the video. If you have not subscribed my channel yet, subscribe it. So the first question for today is, the cardiac nurse received laboratory result on the following clients. Which client warrants immediate intervention from the nurse? Option 1, the client who has an INR of 2.8. Option 2, the client who has a serum potassium level of 3.8 milli serum potassium level of 3.8 milli equivalent per liter. Option number 3, the client who has a serum digoxin level of 2.6 mg per dl. Option number 4, the client who has a glycosylated hemoglobin of 6%. So the right answer for this is option number 3, the client who has a serum digoxin level of 2.6 mg per dl, because it is more than the normal range and it will cause digoxin toxicity. Remaining options are within normal limits, so we need to eliminate that, and option number 3 is the correct answer for this question. Now, the question number 2. The nurse is administering medications on a cardiac unit. Which medication should the nurse question administering? Option number 1, warfarin, an anticoagulant to a client with a PT of 14 and an international ratio of 1.6 mg per dl. Second, digoxin, a cardiac glycoside. Second, the digoxin, a cardiac glycoside, to a client with a potassium level of 3.3 milli equivalent per liter. Third, atenolol, a beta blocker for the client with an aspirate aminotransferase of 18 unit per liter. Fourth, lisinopril, an ACE inhibitor for the client with a serum creatinine level of 0.8 mg per dl. The answer for this question is option number 2, that is digoxin, a cardiac glycoside to a client with a potassium level of 3.3 milli equivalent per liter, because this is an abnormal value and remaining options are within normal value. So the third question is, the hospice nurse is working with a volunteer. Which task could the nurse delegate to the volunteer? Option number 1, sit with the client while he or she reminisces about life experiences. Second, give the client a sponge bath and rub lotion on the bony prominences. Third, provide spiritual support for the client and family members. Fourth, check the home to see that all necessary medical equipment is available. So in this, the right option is 1, because this work can only done by the volunteer. Remaining work need to be a professional in order to accomplish the task. So fourth question is, the client is in ventricular tachycardia. Which intervention should the nurse implement first? Option number 1, defibrillate the client. Second, assess the carotid pulse. Third, administer epinephrine IVP. Fourth, start cardiopulmonary resuscitation. And the right answer for this question is option number 2, assess the carotid pulse, because whenever patient is in ventricular tachycardia, it is the responsibility of a registered nurse to check the pulse. If it is present, then start the treatment. If it is not present, defibrillate the client. So the last question for today is, the nurse is caring for the client on a cardiac unit. Which client should the nurse assess first? Option 1, the client diagnosed with angina who is reporting chest pain. Option 2, the client diagnosed with CHF who has bilateral 4 plus peripheral edema. Third, the client diagnosed with endocarditis who has a temperature of 100 degrees Celsius, 100 degree Fahrenheit, Fourth, the client diagnosed with aortic valve stenosis who has syncope. The right answer for this is option number 1, because the remaining findings are expected in the given disease conditions, but in the option number 1, client is experiencing chest pain, so it might be the myocardial infarction. So it is an unexpected finding in angina. So this is the right answer. If you want to take NCLEX classes from us, if you want to take classes from us, you can WhatsApp on the given number. You can like, comment, share and subscribe this channel for more updates. Thank you for following.